ultra-processed foods are now at the center of a growing national conversation, with Health and Human Services Secretary Robert F. Kennedy, Jr. and his team pointing to these products as major contributors to America's chronic disease crisis. While the exact definition of ultra-processed foods is still under debate, many familiar items like sodas, packaged snacks, and sugary cereals are considered part of the category. But not all ultra-processed foods are created equal. Items such as protein bars, some canned fruits, nut milks, and tofu also fall into this group, yet can play a role in a balanced diet. Public health experts are cautious about blanket labeling. Michele Polacsek, professor of public health at the University of New England, notes that even when foods are technically ultra-processed, their nutritional profile may make them useful and not necessarily harmful. Marion, Nestle, nutrition professor emeritus at NYU, echoes that sentiment, warning that targeting all ultra-processed foods would be unrealistic. The American diet relies heavily on these products, with more than 70% of daily calories coming from them. Ultra-processed foods typically contain manufactured ingredients, substances designed to enhance flavor, appearance, and shelf life. While these additives might make foods more appealing, research suggests they often replace healthier alternatives and lead to overconsumption. According to a 2024 study published in the British Medical Journal, ultra-processed foods have been linked to around 30 health conditions, including heart disease, diabetes, cancer, and certain mental health disorders. In response, Kennedy's Make America Healthy Again Commission issued a 69-page report calling for federal guidelines. On July 23, the Department of Health and Human Services announced a plan to gather public input in hopes of crafting a clear, science-backed definition. Still, researchers like Polacsek caution against rushing policy changes. Without better understanding of which ingredients or processes are truly harmful, sweeping reform could misfire. While the debate continues, Nestle advises moderation. Though some ultra-processed items may contain essential nutrients, the emphasis should remain on variety and whole foods. A 2023 USDA study even demonstrated that a diet made up of over 90% ultra-processed foods could technically meet nutritional guidelines, though it lacked in areas like whole grains and had high sodium levels. The takeaway? A healthy diet isn't about total elimination, but thoughtful choices. Enjoying food, Nestle says, is part of living well.